How's it going? Okay, I thought that this was supposed to be a no-shade zone. Shh. I'm feeling like it's a little breezy. It's not like frigid, but it is a little breezy. How is it going? I mean, that was so sorry. Y'all hungry? Like, your blood sugar is getting low? Why didn't you bring some Red Bull? You don't even have an excuse. Who here is you all are teenagers, like we have nothing but energy. I'm really excited to introduce our next guest. Before I tell you exactly where he works and what he does, I'm gonna give you some fast facts, and I want someone to tell me who am I introducing, okay? One, he has a brother that is the mayor of Chicago, Rahm Emanuel. Two, who knows Ari Gold from Entourage? Are you even allowed to watch rated R shows? Isn't that rated R? What is like the age limit on that? You all know Ari Gold from Entourage? That's also his brother. Number three, he got called to the White House yesterday and was supposed to be there today, but he decided to be here with you all. Who am I describing? Yes, stand up. Let's give him a big round of applause as he comes out.
Thank you.
Absolutely.
So, I thought that I would begin with a little, wow, the lights are really bright. Can't see past like 5 feet here. With a little challenge. So you're going to have to look at the monitor, and I want you to tell me if you recognize anyone in that room. Yeah, right. You see the back of someone's head, and you can instantaneously tell who he is. Anyone else in the room? Look, it's a hot day in July 2009, before most of you were born, or at least you were in diapers, right? We're trying to work out stuff on the Affordable Care Act, and it's kind of frustrating. Not much is happening. There's a sort of logjam in the Senate. It's a Friday afternoon, around 4 o'clock, and everyone else around the table are the people in the White House working out this stuff, and the president walks in to give us a pep talk. And he is like 100% confident it's going to happen. That is about the most foolish statement he could have made. Why? There had been 100 years of attempts to get health care reform passed in this country, and every one of them, beginning in 1912, failed. Here we are in 2010, 100 years later, and nothing's happening in the Senate, lots of negotiation, no progress, and he's confident. He says, I feel lucky. I feel like it's going to happen. Most of the people around the table, despite they're having smiles on their faces, are like, you know, what's he taking that he thinks it's going to happen? Because we're pretty fatigued. And then it did happen, about 9 months after that meeting. So if you're sitting there with the president, he gives us sort of a bit of a pep talk, and then he wants to go around the room, talk about stuff. What's your big idea for him? What are you going to say to him? How are you going to persuade him? You have about, 60, 90 seconds to talk to him. What do you think you would say to the president? So, as you can tell from that picture, I'm not a fashion guy, right? I don't do Hollywood. I'm actually not a politician. That's my other brother. I am a lowly professor who spends his days looking at numbers, writing papers, doing research. But the one thing I do is spend a lot of time looking at numbers and try to figure out what we should do in light of the numbers. Now, when I was in the White House for 2 years, I did work on the Affordable Care Act, but it wasn't the only thing I did. I also had the privilege of working with the First Lady, Michelle Obama. Yes, wonderful lady. On her Let's Move initiative. You know, she's concerned about obesity in this country and trying to figure out what we could do to help and push it along. So I want to show you some numbers of Philadelphia because I want them to make you begin thinking about the kind of stuff that Michelle Obama was thinking about and motivated her. So the first number is this: teen weight. This is the number or percentage of kids in Philadelphia who are obese. Not just slightly overweight, not just a little pudgy, obese. 1 in 20, roughly. 1 in 6. I mean, not 1 in 20. 20%. 1 in 6. All right? You probably know someone, or more than someone. This is not a good thing. You're obese as a teenager, it's almost inevitable you're going to be obese as an adult. And we are slightly above the national average in Philadelphia. And as you well know, the nation is not doing well on this score, and compared to most other countries in the world, we're pretty bad. Right? The fat American has become the taunt, not just the ugly American. Teen exercise. As you can see from these data, that we're really not good at, right? A quarter of your friends don't even exercise once a week. Now, the data show, and again, I'm just a data guy, I'm just a professor, right? You want to live a long time, you want to live healthy, and by the way, you want to be happy, not depressed, feel up. 30 minutes, moderate exercise. I'm not talking about you got to run a marathon 5 days a week, right? Completely changes your life. Doesn't guarantee you won't get, you know, some dreadful disease, but improves your life expectancy 40%. 5 times a week, just 30 minutes. 150 minutes a week. Anyone not able to do that? We do a very bad job in Philadelphia. And this, despite the fact that Philadelphia, very walkable city, right? Built before the cars, built because people had to walk. More parks than any other city in the world. More green space in Philadelphia. People don't take advantage of it, and in particular, your peers. Next one, eating fruits and vegetables. All right? We know, again, big issue, eating right. I showed you the obesity data. Fruits and vegetables, they're good anti-cancer. They're good for diet, nutrition, and just overall health. 5 servings a day, and you can see we do worse than the country, and the country does worse than every other developed country. 1 in 10 of you kids eats 5 servings of fruits and vegetables in a 24-hour period. We are not doing particularly well. Now, the next one is teen smoking. And here, actually, Philly does pretty good, right? Not many, only 1 in 10 teens smoke. Now, the reason this is like the most important number on smoking is if you don't smoke by the time you're 21, the chance that you're going to smoke goes almost to 0. So if we can get teens through their teenage years to 21 without smoking, right, they're not going to smoke the rest of their life. No chance of lung cancer, not no chance, but really low chance of lung cancer, no chance of emphysema, and smoking has lots of other bad effects. Not one good effect from smoking, right? Again, we're actually doing better than the country, but of course we could do even better. Drinking, again, another big problem. And here again, Philadelphia seems to do better than the national average. But it's not 0. 1 in 7 kids binges child immunization. This is getting a comprehensive set of vaccines. Right? One of the great achievements of the 20th century was having vaccines so most kids could survive and not die of infections, whether it's whooping cough or measles or mumps. I was just reviewing this history with my students yesterday. You know what the average life expectancy was in 1900? Under 50, very good. I don't know who said it, very good. Just under 50, 48, right? 1900, 100 years ago. Today, it's almost 80 years old, right? Most of that increase, right? Better housing, better food, but it's also immunizations. Young kids not dying from infectious agents. A quarter of kids in Philadelphia don't get the immunizations, right? By the way, it doesn't just affect those kids, it affects all the rest of us, because if they don't get immunized and diseases spread in the city, we're liable. I'm back in that room, and you can see a better picture of the president. And what you can see there, right, he's got that smile on his face. He's feeling optimistic. After all, this is only 7 months into his presidency. He had another 7 years of hard, rough riding, right? You're sitting there with the president. What would you tell him, given what I've shown you about exercise, obesity, not eating well, smoking, binge drinking? These are really big public health problems. How are we going to solve them? What are you going to do? So I have a simple challenge for you, not very complicated. So I challenge you to improve the health of your community by enabling people of all ages to bring 3 habits into their lives: good nutrition, regular exercise, and emotional health. Now, I have a very particular word in there, and I don't know if you've picked it up, but it's habits, right? All of us can exercise, this week and next week. But unless we make it a habit, something we do every day, every other day, it's built into our regular schedule, we're not going to continue with it, right? I don't know how many of you make New Year's resolutions, but it's just about this time in the year, the 1st of February, where everyone around you is breaking their New Year's resolution, right? They swore they were going to eat better. Stop eating that sugar. No more candy. They're going to go out for a 3-mile run every other day, all going up in smoke right about now. Why? It's not a habit. They're not built it into their daily schedule, right? So the real question is, how can we make these 3 activities, right? Good nutrition, eating those 5 fruits and vegetables, servings of fruits and vegetables every day. Good exercise, 30 minutes, 5 times a week. And having emotional health, being connected with people, feeling good about your life. How can you make that pervasive through your community such that it's a habit and people are doing these things every day or every other day? That's your challenge. Not just having people do it once or twice, but making it a habit. Thank you very much, and I look forward to your questions. Sit down, sit down, sit down.
Answer. And Dr. Zeke is more than just a professor. Did you all Wikipedia him? If you have a full-on Wikipedia page, you're just more than just a professor. I wanted to shout out, you're also an oncologist.
Yeah.
All right, questions?
Hold on 1 second so everyone can hear you.
My name is Rashid, and I'm a junior at First Philadelphia. And actually, to answer your question about what would I do to ask Obama, I would actually tell him that each school should have at least some type of physical health or gym to every grade, no matter how old you was or what school. And any teen who's caught smoking or drinking should have some type of punishment.
Should have what?
Some type of punishment or like be disciplined some type of way. Not like abusively, but mentally, so that they could know what's wrong.
You want everyone to have physical health, physical education in their school?
Yes.
Right? And then you want to have people caught smoking or drinking?
Yeah.
Some kind of punishment. Do you have something in mind?
Some of the, I guess, like have them sit down with a school counselor or something like that, or some type of counselor to ask them why they're making the decisions they're making.
Why do you think most people smoke and drink? Why do you think your peers? Yeah. I mean, they're not having fun. We're not doing so well, right? They're feeling isolated. They might not have friends. Something bad might have happened at home, right? Part of that's our responsibility to reach out to them, right? They're not able to reach out.
Some people even do it just because their friends or family.
Peer pressure.
Yeah.
Right? So we need peer pressure on the other side. You guys got to think about all the other ways, again. These are transitory. How can we make it a habit of someone every day? There's a question over there. Sorry, I can barely see.
Good morning. My name is Samaj Gaskins, and I'm from Parkway Northwest High School. And at this moment, I am trying to further healthy after-school program for younger students. But the question that I have for you is, what do you mean by emotional health?
By what?
Emotional health.
Great question. What do you think? Wait. Get that microphone back in your hand. What do you think? What do you mean by emotional health? How do you know when someone's doing well?
Well, by their appearance, if they're like, if their face is clear, or if they're not heavy, or if they're not sick. You know what I mean?
Right. So one thing, you make that assessment every day walking down the halls of your school, right? Someone got a smile on their face, or are they looking grumpy, right? Or snapping at you. Very, very simple, right? But emotional health is, there are two big plagues, right? Depression and anxiety. There's many others, but those are, and they take many, many different forms, right? Sometimes people drown themselves in alcohol or smoking or drugs, right? Or social isolation. But if someone is, emotionally healthy, they're going to have a smile on their face. They're going to be purposeful. They're going to be want to do things, right? They're going to be interacting with other people. Probably the most important thing that you can do, I'm not going to tell you how, is, human connection, people to people, really, really important. Now, most of us, and, you might not think this, but when I was your age, what was my worst fear? Going into the cafeteria and sitting down and having lunch and trying to find that right table. I hated the cafeteria. The worst. I'm a relatively shy guy, and I don't like going out and reaching out to people. It's taken me a long time to be more outgoing, right? I'm a nerd, a wonk. I got two brothers who are like much more socially at ease than I am, right? But reaching out for me is really hard. But, once you do it, you can see it really makes a big difference. Ever sit on a train or a bus or something, you don't say anything to the person next to you, right? Turns out there's lots of studies. You think the bus ride is better, and they think the bus ride's better if you just ask them, how you doing? Or whatever, right? You just have a little social connection. So start with the social connection, and then work your way up. Find out what's going bad or good for someone. So that's what I would focus on.
Okay, thank you.
Right here. Sorry, I'm having a really hard time seeing. So we got a question over here?
Yeah.
We'll get a question here, and then we'll get to you.
Okay. Hi, my name is Kashmir from Frankfurt High School. I was going to ask, what was your hardest decision on making this choice, like trying to help with health choices for students? Like, what made you want to choose this choice?
Which choice?
Like, help in healthcare and for health.
Why I wanted to help with healthcare?
Yeah.
It's a really simple thing. There are two motivations I have. Motivation number one is I'm the son of a doctor. I also happen to be a doctor, take care of people, or I took care of people who had cancer. And, you know, I grew up with the idea that everyone should have a good chance in life, and critical to having a good chance in life is to be healthy. And it's really easy in the 21st century to get people to live a big, fruitful life without a lot of problems. And yet we had 50 million people in America who didn't have health insurance. And it wasn't just difficulty getting to the doctor. It was the financial burden on people that if they went to the doctor, they couldn't go to the movies. Maybe they couldn't even put food on their plate. It just seemed to me unfair. And so I wanted to solve that problem. The second problem is, and this is a little wonky and complicated, but you know, providing health insurance and health coverage to people in America is very expensive. And one of the consequences of it being very expensive is that we're not supporting schools, we're not supporting the environment, we're not doing a lot of other stuff we should be doing because we're spending so much on health care. And so I was like, you know, these things are connected. Not enough people have health insurance, and we're spending way too much. We're just not doing a great job. And so my goal was to try to do a great job, get everyone coverage, and to bring the cost down so we could use money for other things that I thought were equally important to health care, but were, you know, when push comes to shove, underfunded. And top of my list, because I am a professor, I am an educator, is better education, more investment in schools, many more things our schools should do. So actually part of my motivation for doing healthcare was education. Okay, does that make sense? Over here.
My name is Brian Lopez. I'm from Kensington Health and Sciences, and lucky for you, our school has something to do with health and sciences. We have dentistry, HRT, and pharmaceutical, which is like pharmacy. And a question that I have for you is, are you partnered with the Eat Right Now program, and like, you know, have you like been experienced with it? Like, what were your experiences?
What was my experience with what?
Like, let's just say in general with like the health of the people.
I didn't get
the organization.
Sorry, I'm not understanding the question.
Yeah, let me rephrase that. Like,
yeah.
What were your experiences with the health organization?
Which health organization?
Most of what you've been in.
I'm not sure I get. Which health organization? Sorry, I don't mean to put you out.
Well, the Eat Right Now. Have you ever been in the Eat Right Now program?
No, I have not.
No?
Sorry.
Oh, it's all right. It's all good. It's all good.
Hi, my name is Dominique Hammond, and I'm a sophomore at Friary Charter High School. My question for you is, like, when there are, you know, programs for emotional health and things like that, so what would you say for people who have, like, depression and anxiety who are, like, afraid to join programs like those because of a fear of being judged?
Yeah, it's a terrible self-reinforcing cycle, which is, right, maybe you're depressed or anxious for a reason, then you don't want to join a program, and then just isolates you more. I mean, really, it takes someone to reach out, right? Maybe that person can't do it, and someone has to reach out, be buffeted, but be persistent. You know, if I had to give you one piece of advice about, I've already given you a piece of advice about making things habits in your life. Good things, habits in your life. Absolutely critical. And sometimes you don't want to do those habits. You know, I'm a big runner, and, you know, sometimes you wake up in the morning, it's like, God, you know, my thighs are killing me. I don't want to go out there and do, you know, 6 miles. You got to do it, right? Really, really critical to just keep doing it. And I think the same thing is for other people. You got to keep going after them and trying to make connections and bring them around. It's very hard. I mean, I don't know how many of you have been downhearted and blue, but I will tell you that when I first went to college, I'm the first kid in my family to have gone to college in the United States. And when I went to college, I grew up in Chicago, and I went to college in Massachusetts, and I was very intimidated. And my whole first semester, I was just like totally depressed. No friends. I went to a place I had nobody I knew. And it was just really, really hard. And fortunately, there was another kid who was always bubbly from a small town in New York near Lake Erie, Jamestown, New York. And he and I bonded. You know, he kept reaching out to me. Now, I'm a kind of liberal guy, and he was a kind of conservative guy. I'm a kind of skinny guy, and he's a kind of big guy. But we loved arguing politics, and that became our bond. You know, and so I think you just got to keep trying to make a connection. And, you know, he and I are still friends many, many years later. He lives in New Hampshire, and, you know, we still talk on the phone all the time. You know, you just think about your life. You think about a day when you don't really connect with anyone, and think about the days when you do connect with someone, right? Those days when you connect with people, so much better, right? Puts a smile on your face.
One more question.
Hi, my name is Justin Harlequin. I'm in 10th grade.
Pull the microphone closer to you. Whatever it is with the speakers, I'm probably deaf at my age.
My name is Justin Harlequin. I'm in 10th grade. I'm from the youth school. You know, Philadelphia, we just got our sugar tax. And I feel that the obesity rate is going to drop drastically because nobody won't be paying $2 for a soda now. So,
you think it's a good idea or a bad idea?
I think it's a good idea. Personally, I don't drink soda at all. I'm strictly water and 100% juice. So, what are your thoughts on the sugar tax?
I'm a big proponent of the soda tax. So when we were in the White House, go back to that picture. Where is that picture? Anyway, when we were in the White House debating how to pay for all this stuff, one of the things we talked about was a sugar tax, and got knocked down, shot down. This is 2009, you know, this is 8 years ago. Can't do it, can't pay for it. Lots of opposition, and there was lots of opposition. And, you know, just think about the benefits. We know that if you raise the price, people are going to drink less, and we still don't have great data, but that we think, and it's important to study it and to make sure it happens, but we have evidence from cigarette smoking that, especially for kids, they're very price sensitive, that if you tax it, it'll make a big difference on their consumption patterns. And if they don't drink as teenagers, very likely they're not going to drink soda and sugar-sweetened beverages later on. But we couldn't pass it. And as you know, had a very rocky time almost everywhere else, but in Philadelphia, it's a beacon to the country, we became the first big city. I mean, they did it out in Berkeley, but Berkeley's another country, right? Philadelphia, first big city in the country, and the mayor did a very good job. And it's a big experiment, let's be honest. It's an experiment. But we got to try new things. If we don't try new things, right, on the obesity thing, we're not going in the right direction. So we got to try some new things. And we'll see if it works. We'll see if we have to tweak it, right? But it's a really good positive sign, and I'm glad to hear that, you know, you're on to water. When I was starting high school, I ran cross country, and the coach said, this is way back, you know, in prehistory, before they really had computers. Definitely before computers. Definitely, you know, probably even before books. But, you know, the coach said, you really shouldn't be drinking soda. That carbonation is not good for you and not good for nutrition. So I stopped drinking soda. And all these years, I've really had very, very few sodas. I tend to drink sodas only when the water is, I travel the world and the water is not good. But getting, again, habits. Getting into the habit, not drinking soda, drinking water, kind of important for that nutrition element. And I think the tax is going to help. Also, what I'm really keen about that tax is it's going to really important stuff. You know, getting universal pre-K in Philadelphia, refixing the parks. So I look on it as a sort of win-win-win kind of situation, you know, a win for people to change their habits, to try to help them change their habits and what they're eating and drinking, a win for the public in Philadelphia because the parks are nicer, a win for our young kids to make sure that they grow up with the best education that we can provide. All right, guys, you're fantastic. You're doing great stuff. Go out there.
Thank you. What did you all think? Good? All right. Unfortunately, I didn't see any exceptional behavior from my point of view to give out some swag. No shade, just the facts. There was like a lot of movement, people were getting donuts and coffee, and I'm like, you all are missing one of the best presentations. So I'm gonna give you an opportunity to really make it up to Dr. Zeke, and that is going to be with putting forth some really strenuous